What if a baby suffers seizures following birth? Now, this could be immediately following birth, or it could be a couple of hours, or it could be a couple of days following birth. What if they've suffered seizures? First of all, seizures are nothing to play with. They are extremely serious. And for our definition of seizures, this is going to be unusual brain activity. When seizures happen, there can be a lot of things that doctors and nurses, medical professionals, that they are going to be concerned about. This is not to say that your baby is going to be dealing with all of these things, but these are just some of the areas of concern. First of all, epilepsy. Epilepsy is something that can be concerning when a baby has suffered seizure, that they're going to be dealing with epilepsy. Another concern is going to be CP, or cerebral palsy, and this can be because there could be an injury to the brain, and depending on the area or the areas impacted or injured, a subsequent cerebral palsy diagnosis, that can be something that can be concerning if a baby has suffered seizures. Another area of concern is going to be cognitive impairment. And this is because of the brain. If the brain has been injured, or certain areas of the brain have been injured, then there can always be a risk of cognitive impairment. And lastly, what I want to talk about is just going back and thinking about your birthing process. What was going on during your labor and delivery? Was this some type of, was it a challenging or a traumatic labor and delivery? Were there non-reassuring readings on the electronic fetal heart monitor? Were you dealing with tachycardia, bradycardia, minimal or absent variability? Were there late decelerations or prolonged late decels? In other words, was the strip non-reassuring? Because if this was happening, if birth trauma was going on, your baby was in a challenging spot where it was not really doing well with the vaginal delivery, and the doctors waited too long to be able to help the baby out, or to be able to use certain types of measures to help the baby. Maybe there was a delay moving to a emergency C-section, if one was even performed at all. If these types of things are going to go on and on, then if the baby runs out of reserves, as we say, if that occurs, then a baby can suffer a brain injury because of a reduction in blood and oxygen, which can lead to the injury. And those types of injuries are called HIE injuries, hypoxic ischemic encephalopathy injuries. In a lot of instances, babies who have an HIE injury, they will suffer seizures, or they will be dealing with seizures, at least initially, because there has been an injury to the brain. So I say all of that just to say that when there are seizures, when seizures have happened, or when seizures are suspected, this is something that if families notice this, they need to speak up immediately to the nurses or to the doctors to let them know of what's going on and the family's concerns as it pertains to this seizure activity. If you have more questions about this, maybe you're watching this video today because your baby has an HIE diagnosis and they have suffered seizures, or maybe they have HIE diagnosis and now maybe there's a subsequent cerebral palsy or CP diagnosis that you and your family that you are concerned about, and you have questions as to what caused this. How did this happen? Was this something that the doctors and the nurses, the medical professionals, did they cause this? And if they did cause it, they should be held responsible for it. Or was it genetics, or was it developmental? If you have these types of questions, what I invite you to do is go and pick up your phone, get your cell phone, and call me. There's a telephone number down below that you see on the screen right now. Call me. Talk to my office about this. This is what we do. Remember, initially, it costs you absolutely nothing to talk with us about your baby story. When you contact my office and you speak with my secretary, be sure that you let them know that you would want to get on our calendar. You got to pick a good date and a time, to get on our calendar so we can know when to call you back. Also, be sure to provide a good working email, because sometimes either myself or Renee, my partner, co-counsel, sometimes we will be able to, or we may have to reach out to you through email for certain things. So just make sure you have a good email address. Before I get out of here, I practice law here in the state of Maryland, and I know from time to time I have people who contact me in my office, and they are not in Maryland. They're in the United States, but they're not in Maryland. If that is you, just understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can work to help you with. But I just want to make sure that you understand that co-counsel, or that local counsel aspect of things, if you are not here in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. Talk with you next time. Take care. Enjoy the rest of your day.